Very good morning to you and a warm welcome to Sky World News. Well, the World Health Organization has told governments across the globe to be ready for a swine flu pandemic. The UN-sponsored body raised its alert status to the second highest level as the first death from the virus outside Mexico was announced. Inside the country, the government said there have been more swine flu deaths. It's called for all businesses that are not crucial to the economy to close for 5 days to try to contain the outbreak. Well, the WHO raised their pandemic alert from level 4 to level 5, the second highest warning, meaning they now have evidence of person-to-person transmission in at least 2 countries. They also urged governments to be ready to cope with a major pandemic and told them to stay alert for large numbers of people falling ill. And in Spain, the first case of person-to-person transmission emerged as the EU warned there would probably be deaths from the disease in Europe.
All countries should immediately now activate their pandemic preparedness plans. Countries should remain on high alert for unusual outbreaks of influenza-like illness and severe pneumonia. This change to a higher phase of alert is a signal to governments, to ministries of health and other ministries, to the pharmaceutical industry and the business community that certain actions now should be undertaken with increased urgency.
Well, the warning came as the first swine flu death outside Mexico was confirmed. A toddler who travelled from Mexico City to Texas died in hospital. President Barack Obama has called for vigilance amongst the American public, but said he wouldn't close the border with Mexico. Our US correspondent, Greg Milam, has this report.
What may have started with Edgar Hernandez in a Mexican village has led the world to the brink of pandemic. Edgar's family believe he was the first victim of swine flu in the world. Mexico is still by far the worst affected country, but over the border cases are spreading across the United States. The only death in the US so far was a Mexican toddler who was already ill when he arrived in Texas. The president, in a prime-time news conference, left no one in any doubt about the gravity of the situation.
This is obviously a very serious situation, and every American should know that their entire government is taking the utmost precautions and preparations. Our public health officials have recommended that schools with confirmed or suspected cases of this flu strongly consider temporarily closing. And if more schools are forced to close, we've recommended that both parents and businesses think about contingency plans if their children do have to stay home.
The city of New York has seen the biggest outbreak outside of Mexico. Schools are closed, and yet no one has any real idea of how far the virus has spread here. Stocks of antiviral drugs are being released to the affected areas, and the message is that the country is ready.
The CDC, the public health community, and the World Health Organization all have said that closing our nation's borders is not merited here. That the focus, the public health focus, should be on mitigating the impact of this virus. And so we are following those recommendations now.
The uncertainty is hardest for families, though, and it's growing. This school in Chicago has been closed after a 12-year-old fell ill.
I was not going to let her come back here until, that I was sure that everything was okay, that they cleaned everything up, and I really want to know if the kid was in her classroom or not.
As more countries fall victim to the virus, containment has now become impossible. Despite that, the EU is considering flight bans. Back in Mexico, there is a growing anger at the speed of the government's response. Experts say public unrest would only make matters worse. It is clear the increase in the threat level is a call to action that no one can ignore. Greg Milam, Sky News, New York.
Well, news of the day.